Let's now look at pros and cons of this strategy of matching. Matching has its advantages. It is easy to communicate. It is useful for strong confounding factors as anticipated at the design stage of the study. It can increase the power of small studies. As reflected earlier, it can also ease or help in the logistics of recruiting controls. It is useful if only one factor is studied. It allows looking for effect measure modification with the matching criteria. These are the advantages. The cons of it, the inconvenience of matching are, at the very outset, it should be understood by the author in terms of what is matching and how to do it and how to handle it at the time of analysis. The whole deployment of matching as a strategy is deleterious in the absence of confounding for that matched variable. It can also decrease power when you have problems in the recruitment, and therefore it also has the other problems in terms of complicating the control recruitment when you have to find a control for a specific matched variable. Matching is limiting if there are more than one factor you are testing for. It does not allow examining association with the matching criteria. Matching as a strategy is deployed for operational reasons in particular situations, like for example in an outbreak investigation setting. The common choice could be the friends or neighbors of the cases. There are advantages. It allows recruiting controls fast. It takes care of, within quotes, gross confounding factors. It may result in some overmatching, which actually sometimes is safer for the investigator. However, we need to keep in mind that this particular deployment of the strategy as friends or neighborhood as controls has to be kept in mind at the time of collection of data and also at the time of analysis of the data with reference to deploying matching strategy for collecting the data as well as analyzing the data. One can break the match with the rationale that matching may limit the analysis. Matching may have been decided only for logistics or operational purposes. The procedure to break the match is first to do the matched analysis and then do an unmatched analysis. Break the match only if the results remain unchanged. Otherwise, you will have to do the matched way. In a cohort study, matching removes confounding, therefore no further stratified analysis is necessary. In a cohort study, matching can increase the precision of estimated relative risk. However, in a cohort study, matching is not cost efficient. Matching in a case control study introduces selection bias at the very outset. It may necessitate further stratified analysis. It may increase or decrease the precision of the estimated odds ratio depending on relative strengths of association between the confounder and the exposure/disease status. It is cost efficient from the point of view of case control study. In summing up, matching is a difficult technique. Matched design means matched analysis. Matching can always be avoided. It is important to create an extra variable for matched set or pair unique to each exposed or unexposed or case control set or pair. Thank you very much.